Mastitis is an inflammation of the breast and it doesn't always lead to infection. This means that antibiotics may not be necessary. It usually occurs in the first few weeks after birth, but it can occur at any time. And sometimes it just comes on so abruptly, out of the blue, it can certainly take a lot of breastfeeding mums by surprise. So what should you expect if you have mastitis? First of all, one breast is usually only affected, and you're likely to see a red patch. It could be swollen, it might be a painful area. You may feel as if you have flu coming on, symptoms of flu, and feeling generally run down too. And in some situations your whole breast might even be lumpy and aching. So you may wonder why this mastitis has occurred, and one of the most common reasons for this is that at some point you became uncomfortably full. Maybe your baby wasn't feeding for a while, you became a little bit engorged, which is a general congestion going on, and a blocked duct can occur in that situation. Blocked ducts untreated can lead to mastitis. So it's really important, certainly as a preventative measure for mastitis, to use hand expression as a means of relieving any engorgement the minute that you start to feel uncomfortably full, because it's at that point when there's a general congestion going on, milk is hanging around, going nowhere, and that a little bit of milk needs to come off your breast to make you feel comfortable again, and this will prevent a blocked duct in the first place. But have a look at the video specifically related to engorgement. And one of the most common reasons for getting engorged in the first place is if your baby's not latched on effectively. So really important that your baby latches on well, gets a good mouthful of breast tissue, and drains the breast as thoroughly as possible. And there can certainly be other reasons why mastitis occurs. It might be something as simple as a bra that's too tight, or even clothing that's cutting into the breast tissue. I have known a lady who got mastitis because of a shoulder bag that she was using very, very frequently, and that was cutting into her breast as she was walking along. And it's also possible that trying to cut down on feeding at the breast, or even cutting it out abruptly, so a sudden weaning you could say, that can actually cause mastitis. So it's always best to be as kind to your body as possible and do these things gradually so that your body can make less and less milk over a period of time. You might also find that if you've started to pump your milk alongside breastfeeding, it's very easy then for the supply and demand to get a little bit out of kilter, and so engorgement can certainly happen in that situation. So I always encourage breastfeeding mums to learn how to hand express, and to always hand express to comfort whenever they feel uncomfortably full, if the baby isn't feeding at that point, or they're not expressing, for instance. And as babies get a little bit older and they start to go through the teething phase before a tooth actually comes through, many of these babies start to come to the breast more often. There can be changing patterns for various other reasons as well, like growth spurts, and all of these changing patterns can cause supply and demand once again to be disrupted, and an engorgement to happen, which can lead to mastitis too. And it's also possible to get mastitis and blocked ducts if you've had breast reduction surgery or augmentation surgery. So if you feel from this video that you do indeed have mastitis, what are the self-help measures that you can do? So first of all, lots of feeding. Give yourself and your baby time, an opportunity to do loads of feeding, resting together, looking after yourself as well in the process. But lots of feeding is paramount. Other important measures that you can take are to use warmth from a shower or a bath, warm compresses on your breast before feeding, coupled with massage as well. All of that together will be a really powerful combination to get rid of this mastitis. And because mastitis is an inflammation of the breast, you can also take an anti-inflammatory like ibuprofen, 400 milligram dosages. That's a really powerful and research-based treatment too. But please bear in mind, if you have a history of asthma or stomach ulcers, or you're allergic to aspirin, then you won't be able to take the ibuprofen. But you can also take paracetamol, and paracetamol and ibuprofen generally can be taken together anyway. But paracetamol, 2 500 milligram tablets every 4 hours is also fine. So if you've been using these self-help measures for a good 24 hours and you're not feeling that there's any improvement, and in fact if you've noticed that you have a temperature of 38.4 degrees or above, this means that you've actually got a fever now. And a fever does suggest that you have an infection on top of the inflammation. So in this situation, you would need antibiotics. Please be assured that most antibiotics are actually compatible with breastfeeding, and certainly the World Health Organization has recommended flucloxacillin specifically, 500 milligram dosages 4 times a day for the treatment of mastitis. There's also erythromycin 500 milligrams 4 times a day, and anyone who's allergic to penicillin can take cephalexin 500 milligrams 4 times a day. And although these antibiotics are compatible with breastfeeding, sometimes babies' poos can be a little loose when you are taking antibiotics, but that's not something to worry about. And I certainly know that some health providers encourage women to take probiotic capsules if they're given antibiotics, and this is because sometimes a thrush infection can develop because antibiotics, although they're going to do what they need to do to relieve you of the mastitis, they can also knock off some of your good bacteria, and this can cause things like thrush, which is a fungal infection, to flourish. And I understand that if you're in the middle of experiencing mastitis, you're likely to be feeling really ill and maybe even psychologically down at the moment because of this situation. But know that it is a temporary hurdle, and very soon you'll be able to comfortably feed your baby again.